The reason you should send referrals to Gulf Coast Endodontics is because, number one, we're going to take care of the patient and they're going to have a great experience and they're going to come back and be happy that you sent them to us. We're going to give them the best quality care possible. We have all the training and the techniques and the equipment necessary. And the third reason is we're going to be there for you. I mean, anytime there's an emergency or a problem or a situation, we'll be there for you to help you out.
We see emergencies the same day, and we're able to handle this because we leave holes in our schedule to accommodate for these emergencies. We know it's a big part of an endodontic office, so we make a conscious effort to try to make that happen.
I mean, the message I want to get across is that we're always there. Whenever you have a problem or a patient who's in pain or something you just don't want to deal with or you just can't deal with, you don't have the time, we're going to be there to pick up the slack for you.
Referring doctors can send us patients either by giving their patients a referral slip, which we provide. If you could call the office, we can send some over to you. Or we have a link through our website where you can refer patients through there.
Right now we do all forms of endodontic treatment, root canals, retreatments, surgical root canals, apicoectomies.
We want all our referring doctors to know at Gulf Coast Endodontics, we use the latest technology and techniques to provide the best treatment for our patients, such as a surgical operating microscope, which allows us to stare into the pulp chamber with a magnification up to 25 times. We also use DEXIS digital x-ray software, which allows us to get a nice image, which we also send to our referring doctors after treatment has been completed.
We use ultrasonic instrumentation in numerous ways. One, we use it to retro prep when we do apicoectomies. So when we make our surgical access, our crypt, it doesn't have to be as large. We are able to access the root end with an ultrasonic tip, so it makes the surgery much more precise and successful. Also, we use it for acoustic streaming when we're cleaning and shaping the canals. We put a fine ultrasonic tip inside the canal, and it actually helps with the ultrasonic vibration clean out the canal much better. And we use it to remove post and separated instruments.
We know that a lot of patients are going to come to get a root canal and be anxious, so we offer different levels of sedation to treat them and to treat those anxieties. First level is just basic, which is nitrous, which we have plumbed into all of our operatories. The next level would be conscious sedation, just a pill form, which is usually the highest level of sedation that we need to get to. But in those extremely anxious patients, we do provide IV sedation.
So our goal is to have a happy patient walking out the door and going back to their doctor's office and saying what a wonderful experience they have, because we know how it reflects on the referring doctor. And also to do great work so that when they put their crown on the tooth, that work will last for many, many years.
We know when you send your patients to Gulf Coast Endodontics, their perception of our office is going to reflect on you. So we make every effort we can to make them comfortable. We have our staff greet them when they come in the door, and also we have a great team environment here. Everyone gets along, and it's a positive experience for the patients.